Hi, I'm Shuai. I'll be talking about how to do a risk assessment for a person that has just tried to commit suicide. So, the first thing you have to consider is the intention of why the patient has hurt themselves. So, you need to ask, did you try to take your life away? Or did you try to do that because you feel like that you want to relieve pain? And then afterwards, you can ask them, okay, how did you do it? Then you assess for their access. For example, if they did it with a knife, if they cut themselves with a knife, then you think about, okay, um, how easy is the patient to be able to access that weapon, and if they have anything, if they have done anything about it. Then afterwards, you think about, have that person thought about hurting other people as well. So, and if they made any plans for it, just to see if any others are in danger, especially if they have children, then you definitely need to admit the children, or admit her, or take the children away from them. So after that, you think about, okay, so do you have any support around that? So if they're in a relationship, or if they're living with anyone, or if they are actually isolated. For example, if they are alone, then if they're living at home alone, then also you think about, okay, what are their financial situation, their social education, their activities, and also um, uh, their social pressure as well. And then you can think about, okay, so what are the stresses? Like, are they under a lot of stress at home, at work, or and how they are dealing with that as well. And then you think about, okay, so what is their age? It's usually given to you in esteem. And also on top of that, uh, you ask them, okay, have they tried to commit suicide before, or have they tried, or have they done the same thing before? And then you think about, okay, what are their past medical history, including all the psych admissions, mental disorders. Then you think about, okay, maybe their family, they have a history of schizophrenia or depression, or and then you think about, okay, are they smoking? Are they taking a lot of drugs? Like, what are they doing to compensate it? And also you think about, okay, because have they had any abuse before, or are they in a very abusive relationship? And make sure that before taking this, you have to ensure confidentiality as well, and always maintain a good rapport by showing a lot of empathy. So, okay, thank you. So, in summary, risk assessment involves asking for the patient's attention, and then you have to think about the static factors. For example, the patient's age. Has she had a history of mental or medical illness? And also, has she tried to do it before? Others are changing factors, which means that is the patient living alone? What is her relationship like with other people? And also her access to weapons. And has she had any plan? And also, you have to think about, does she have any stress in her life? On top of that, we all know that drugs and alcohol and also other factors that could make her intoxicated could make things worse. So that's all the important factors of a risk assessment. So when to admit the patient, you have to admit the patient if they have suicidal ideations or if they present with psychiatric diagnosis.